Ptosis causes a medical condition. Is this cosmetic surgery or medical?
That's a really
What
good
does it
question.
fall under? Does it,
Yeah,
does it
'cause
get
if
covered
it's-
by insurance? Or?
Yeah, because if it's gonna cause an impairment to your vision, right? It's
Correct.
medical, no?
Hey guys, it's me, Mike.
And me, Catherine, and welcome to another episode of We Need to Talk About This.
And we're gonna be talking about droopy eyelids, and we do have an ophthalmologist. His name is Dr. Jason. Hey, how are you, doctor?
Hello, hi, nice to meet you.
Okay, so droopy eyelids, I never, to be honest, before we did this episode, I didn't even know that was a thing.
So it actually originated from the Greek term ptosis, which actually means to fall.
Okay.
So where it came about is in ancient Rome or Greece, essentially what happened was that they felt that the evil eye would cause the spirit to be weak, and that results in the eye drooping as one of the signs of that.
Oh, and so now we know that that is definitely not the truth.
That's not the truth.
You're not evil.
It's not evil.
You're not possessed.
It's just basically something that happens when you age, right?
Exactly. So as we grow older, as any part of our body
Yeah.
has an elasticity limit, it kind of loosens itself, and it sort of kind of comes down and blocks the vision. So that's where it kind of gets
It
significant.
starts to block the vision.
That's right. When it starts to block the vision, it actually
wow.
affects the superior part or the upper part of the person's vision. And in some cases, what they try to do to overcome that is they either lift their eyebrows or they even tilt their heads to try to use the bottom part of their vision
My
to
goodness.
see, and they try to walk.
Sounds
Right.
awful.
There are certain habits that can cause ptosis, things like eye rubbing or even contact lens wear.
Wow.
So contact lens wear, if you think about it, how we put contact lens in, we actually use our hands to pull the eyelids
Stretch,
outwards,
yeah.
stretch it outwards. And imagine doing it over 20, 30 years.
Yeah.
So the eyelids actually get very loose and they start to droop. And that's how ptosis can occur. 10% of patients with ptosis, they have congenital ptosis. Congenital ptosis is ptosis which happens at birth. And it is not common. It's in about 1% of the population.
Is that due to genetics?
It's due to genetics.
Okay.
Right.
Yeah, and the eyes are just smaller from birth. So in terms of treatment for ptosis, the treatment is actually surgery. If you have a look at this diagram over here, this is a cross-section of the eye, and this part is the upper eyelid. So this is the cartilaginous part of the eyelid, called the tarsus, and this is the muscle that actually pulls on this cartilage to pull it upwards. As we grow older, this muscle becomes sort of dehisced or sort of becomes very thin. Surgery essentially catches the muscle to tag it onto this cartilaginous part and sort of restore the height of the eyelid.
Are there different types of ptosis?
Yes, ptosis can be divided into 3 big groups. The standard classic ptosis is where there's drooping of the upper eyelid. It's also called blepharoptosis. The other types is overhanging of the skin of the eyelid, called dermatochalasis. So if you look in the picture, the lady looks as if she's got ptosis, but actually the skin is overhanging. If you lift up her skin, you can actually see the eyelid margin quite nicely.
Is that an easier one to fix?
Essentially, it is easier because this just involves the removal of skin itself.
Right, because
without
the eye is
muscle.
working fine.
Exactly. The last type of sort of droopy eyelids is this gentleman here, which he's actually got what we call brow ptosis. So in his case, the eyebrow is kind of droopy. So what we do is we actually do a brow lift where you lift up the eyebrow. So by lifting up the eyebrow, it actually kind of pulls everything up and it's clear again.
Can it cause anything else if you don't get it fixed?
Generally, in older people, the only reason why you need to get it fixed is due to their vision being affected or them getting a neck ache or a headache from the ptosis to compensate for it. But in younger children, the vision actually develop until about 8 years old.
Right.
And then the brain favors the better eye. So if there is a difference between the vision in both eyes, essentially the other eye, which is the weaker one, is neglected. And that is the term where the term lazy eye comes from. And once they reach the age of about 8, the eye is forever poorer than the other one.
Ptosis causes a medical condition, right? Is this cosmetic surgery or medical?
That's a really
What does
good
it fall
question.
under? Does it,
Yeah,
does it
'cause
get
if
covered
it's-
by insurance? Or?
Yeah, because if it's gonna cause an impairment to your vision, right? It's
Correct.
medical, no?
That's medical to me.
So how we actually differentiate between medical and cosmetic will then depend on whether or not the ptosis affects the visual axis.
Right.
And how that is being assessed, we do a series of measurements. What we normally do is really just to
Oh, you've
use
got
a
the
torch.
torch.
So that's a
Oh.
torch. And what I do is I usually I'll shine on Mike's eyes. And you
Yeah,
can
'cause I'm
Okay.
older.
So look at his eyes, and you can see the 2 reflex.
Yeah?
You see the 2 light dots there. So that means that it's not blocked by the eyelid, so he doesn't actually have ptosis. And that's the same for your case as
What
well.
about
Yeah.
me, Mike?
Yeah,
Can we
good.
see?
You're good. Yeah. Very, very nice.
Okay,
Yeah.
okay. So if we ever wanted to get surgery, it's cosmetic.
Yeah,
Yeah, right.
not
This
medical.
point in time is cosmetic. The other way we differentiate between it functional or aesthetic as we call it, is by a machine called a visual field machine. What it does is that it plots the number of dots that we can see taped and untaped. So we have to do the test twice, one with your eyelids untaped to see what we can see at the top, the other one with the eyelids taped up. If there is a significant improvement, then that's medical. If there's no change, then it's more aesthetic. So there's always a question that asks, is ptosis surgery the same as double eyelid surgery?
Right.
So actually, it's different. Double eyelid surgery is essentially forming an extra crease in the eyelid for cosmetic purposes. But ptosis surgery actually involves lifting the eyelid upwards to clear it off the visual axis to allow the person to see better. Some ptosis surgery techniques involves the forming of a double eyelid as part of the surgery. So you kind of get it as a byproduct.
Two in one.
I still don't even understand what a double eyelid is.
Never mind.
I don't get it.
Don't worry, Mike. But okay, for someone who needs to go for surgery for ptosis, what is the recovery period like?
So what happens is during the first week, there will be stitches. Eyelids will be a bit swollen. And then the stitches will be removed at the 1 week mark. Usually it's about a 2-week rest. By about 2 months or so, everything should be back to normal already.
So do you have any advice you can impart to our viewers?
Do not think that ptosis surgery is a cosmetic surgery. It's more than that. If it's affecting your vision, it's affecting your life. If you do have significant ptosis, please come and see either a plastic surgeon or an eye surgeon who has a special interest in eyelids, like an oculoplastic surgeon.
Well, thank you so much, Dr. Jason.
You're
We
welcome.
appreciate having a chat with you.
Thank you so much
learning
as well.
about ptosis. All right, guys, thank you so much for watching. We'll see you next time on We Need to Talk About This.
If you enjoyed this clip, don't forget to catch our main series, Let's Talk About Health, on Channel 5 and MeWatch.